Hi, everyone. How's it going? Tom, did you get a haircut? You look different. No? All right. I love how you're signing even that. Thank you. uh, uh, I just have a few updates, but we have Dr. Dalal and Velma on the line to talk about our overall plan for as we approach winter, working with individuals experiencing homelessness. And they've put a lot of pieces together and are still working on some other components of it. But I'll just give a quick COVID update, and then then I'll turn it over to them. So we're up to a total of 3,299 COVID cases in New Haven since the start of the pandemic, and still at 113 fatalities. We're continuing to see cases slowly increase in the city. And as folks have seen, it's in the region and the state as well. We're monitoring it very closely. Our cases are still comparatively quite low, but we're very concerned about it. And as I always do, is keep reminding people to wear masks and social distance. There's more and more evidence that shows that masks are hugely, hugely helpful in slowing and reducing the likelihood that the virus spreads. A couple of other quick updates. As folks, I imagine know, it's really important to get flu vaccines, and the health department has been working to facilitate different sites around the city where they will be offering flu vaccines for people. That calendar of those different events can be found on the health department website. You can just Google City of New Haven Health Department flu vaccine, and I found it very easily. And also, we are working with the State Department of Public Health and have been for a little while now on preparing for a mass vaccination for that day down the road when we're likely to have a vaccine for COVID-19. Director Bond's going to share some details on a future a press conference on that. But I just wanted to note for people that that's something that we are working on and not quite prepared to share the details. I think that's all I have as far as COVID updates. But so why don't I hand it over to Velma and Dr. Dalal.
Thanks, Mayor. So I wanted to share with you some of our thinking and strategy around how we're going to deal with this winter. As folks know, this winter is going to be a tough winter. It's a little bit different, or a lot different than previous winters, although we did have some cold months at the early part of the pandemic, so we have some experience to learn from. And we also have the experience of working through the pandemic with our individuals experiencing homelessness and our partner agencies on what we can do this time around to keep safe. I guess to just emphasize the point is our goal here is to try to keep folks as safe as possible. We have, dual challenge here: keep them safe from COVID, and then keep them safe from the elements. But also we want to do it as humanely as possible. We want to make sure that the services we provide are meeting people where they are. We are very lucky in New Haven to have a number of partner agencies that have been providing these services for many, many years. We've also have a tight partnership with the state and the region on coordinating services. So I want to share with you some specifics of how we're thinking about making sure our homeless individuals are safe. And ultimately, in the era of COVID, that means if our individuals that are experiencing homelessness are safe, that means our community is safe as well, especially with respect to reducing the risk of spread. So the first thing I'll share with you is that we had tremendous success over the summer in getting people housed. The state had a substantial commitment, both in terms of resources as well as strategy, in getting folks out of situations where they're homeless and into permanent housing. The rapid rehousing strategy resulted in statewide almost 1,100 individuals finding permanent homes, which is a spectacular achievement, of which over 300 of those were in the New Haven region. We see no reason to stop that strategy, even though that official initiative came to a close at the end of September. We think the approaches that were used during that initiative should be used throughout the winter. So we'll continue to work to aggressively house individuals. And this is ultimately their pathway to a better life and the support they need to get in a more permanent situation. Secondly, we'll be working in partnership with our with LCI and economic development to ensure that our eviction prevention programs are being well utilized, to make sure that the inflow of folks that may be at risk of homelessness don't actually end up in the streets. So we do want to work substantially at the eviction prevention level as well. But that still leaves folks that are going to be unsheltered and they're going to be currently using the sheltered system. So we estimate, currently, there's probably over 300 individuals, up to 350 individuals that are currently either unsheltered or currently using shelter systems. So for those individuals, what we're trying to do is trying to have accommodations that are as safe as possible. And again, we experienced a model that was kind of almost forced upon us during the pandemic, where we moved people to hotel rooms. This model turned out to work spectacularly well. We had minimal number of cases of COVID transmission in hotel rooms. We are working with the state to secure a pretty large number of hotel rooms for folks over the winter as well. And this is not just a place to stay where people will be out of the cold, but it's also a place where they can receive services. And in fact, this was the platform that was used to bring people to permanent housing as well. So again, it feeds into that strategy around permanent housing as well. There's been a number shared already with the media around 150 beds. That's our understanding as well, is that we're hoping to secure that many beds. We're waiting for the state for some word, and if possible, we'll try to enhance that number as well. There are still some shelter beds that are not hotel related available. These are beds that have been reviewed and follow strict social distancing protocols and COVID safe protocols. And those are actually currently being used, and we anticipate them being used over the winter as well. It's not nearly as many as we would have in a normal winter, which is why we need to supplement with those hotel beds. Finally, we typically provide warming center services over the cold months. We will continue to do that. Our capacity, again, we have to think about it a little differently. Currently, we're seeking applications for warming centers. We anticipate that we'll have 2 overnight warming centers with a capacity of 25 individuals each. Again, they would be contingent on them having the appropriate facility and following the appropriate COVID safe and social distancing protocols. We also anticipate having a daytime drop-in / warming center as well. Again, we recognize that there are a number of facilities that are no longer be available, especially if COVID cases go up, and we're not able to offer informal facilities for folks to warm up. So we are looking to have a daytime drop-in center / warming center as well. We're also working with our emergency operations team to identify larger locations for severe cold weather. We don't have those specific locations nailed down yet. It's a bit of a moving target. We know that with schools planning to go back in session and our universities back in session, some of the facilities that were available to us over the early part of last spring will not be, but we do have some good leads on larger facilities that could accommodate more individuals in the case of severe cold weather protocol. So I think that's my main update. Velma, feel free to add anything that I missed or maybe amend if needed.
You did a great job.
Thanks, Velma.
Great. Does anyone else from the team have anything to add? Director Bond, anything to add? No? Okay. Any questions from folks? Tom, go ahead.
Thank you. And thanks, Dr. Jalal. That was very helpful. I wonder if for Dr. Jalal, could you provide a bit more information on how many shelter beds are currently available, where, and is anyone currently still housed in hotels in the way that the city was and the state were putting up homeless people in hotels, or is there no one currently in hotel rooms?
Yeah, we do still have a handful of individuals in hotels. Again, we housed over 300, a lot of them from the hotels, but you can't be 100%. So there's still a few folks over at the hotels. In terms of number of shelter beds, we right now, the quote unquote traditional shelter beds, we have about 50 or 55. Is that right, Velma?
55.
55 beds, which is substantially reduced from normal years. And then I don't know if there's another part of your question. I think that.
Are they at the Grand Avenue homeless shelter? Where are these shelter beds?
Columbus House.
At Columbus
House and Martha's Place.
Thank you. And then also, Dr. Dewall, you said that some of the strategies that the state and city worked on over the summer were very successful, and you think that they should be continued. You mentioned putting up people in hotel rooms as one of those. Could you go through either one or two other strategies that you think the city should continue to do to serve its homeless population this winter?
Yeah, I mean, I think having that, one of the things that we did over the summer, but many of the lessons will apply, and we actually continued this through most of the fall as well, was having a drop-in facility available. And that really helped a number of individuals who are unsheltered, rough sleepers, those who, of their own volition choose not to kind of go into other, sheltered environments or be housed for various reasons. That having that facility available was very important in terms of connecting folks to services, and especially during COVID, it's going to be very important to have a facility where people get connected to care or testing if they need it. So that's something that we're looking to do over the winter as well.
Thank you for that. And then if I may ask one more question before kind of yielding the floor to Velma. Velma, I wonder if you could just share a bit with us about what you have heard from homeless people you work with in the city in the past couple weeks and months. Kind of what are people telling you about what they need right now from the city, from the state, from anyone? What have you been hearing?
So there are a combination of responses and requests. There are lots of questions about housing. People are really interested in their own permanent place to live. We've also had questions about what's going to be happening for the cold weather, and which Dr. Dalal just recently shared. As far as most people are used to us having warming centers, so there's been the question about warming centers, and those we're hoping to have online in towards the end of November to have the warming centers online.
Thank you.
Anything else?
Sorry,
I have a few other questions. But yeah, go.
I'm sorry.
Go for it.
Mayor Elicker, you said we were up, the city was up to 3,299 cases. What was that up from?
Are
you giving an update? Are you giving a specific time frame of an update, or just that's where we are at this point?
So since the beginning of the COVID crisis, we've had 3,299 cases in all.
Has there been a significant uptick recently or anything like that?
There's been an uptick. The rest of the state, or certain areas in the rest of the state, have experienced a more significant uptick, but we have also experienced an uptick in the city. I don't know if Director Bond, do you want to go into any more details on describing what that uptick looks like?
So as the mayor mentioned, he reported the cumulative number of cases, and what you see in front of you are the cases for the last 2 weeks. And so we are seeing a slight uptick in cases. Actually, I'm going to take the word slight out. We have seen an increase in cases in comparison to 2 weeks prior, where we were only at 20-something cases. And so we want to remind individuals to remain vigilant, to really follow the safety protocols. I do want to empathize with the community and want to commend them for all of their efforts to safeguarding themselves and others. And I know that there's a fatigue of a sense of wanting to get together with family gatherings and social gatherings, but it's very critical as we're starting to see surrounding towns and in the red. We are still in a moderate, so we want to maintain our numbers and remain vigilant in the safety measures. So reminding everyone with the 3 W's, wearing their mask and wearing it correctly, washing your distance, and washing your hands as often as possible, or hand sanitizing when washing your hands is not feasible.
Thank you.
You're welcome.
Yeah, and I can add to that. We were talking about whether to share this graph or not, but just to caveat, this is my graph. But if you look at, this is over the crisis, I generally enter in numbers every couple of days, and so it's not 100% accurate, but the blue line is the city of New Haven's cases, and the gray line is the state of Connecticut's, and the left axis is the city's cases. So you can see that over time, we've generally, in the last several months, had between 2 to 10 cases a day. But recently, we've seen slightly above 10 cases a day on average, and that's concerning to us. And as you see, the state's numbers, when things were mostly, the cases were lower throughout the summer, they had around 100, under 200 cases a day, but the state's numbers are also significantly rising as well. Tom, you said you had another question or two?
I do, yes. Thank you.
Go for it.
The governor announced yesterday that the state saw a 3% positivity rate for the first time since June, kind of marking the increase in cases statewide. Do y'all have any either updates now or perhaps at a future meeting on testing in New Haven, both kind of how much testing is going on any given week, and also how the positivity rate has changed recently?
Yeah, so Tom, that's a good question. In regards to the positivity rate amongst the state, as you know, the governor announced a 14-day threshold announcement where he would announce alerts when we change from yellow to red, for example. New Haven, according to the 14-day rolling averages, are still in the yellow. And in regards to what we are doing around testing and supporting testing efforts to mitigate COVID as much as possible, we have a testing logistics teams that meets with the community health centers, the Yale New Haven RV mobile van, and our team to ensure that we're monitoring where the testing sites are located and then identifying any potential hotspots where we may need to do pop-up testing. And so we are continuously assessing that and update our calendar on our city website where the testing sites will be weekly, because they do change, varying to your point on where we need to prioritize testing.
Tom, if I could just add, so given the state's increase in availability, or the increase in availability of state-supported testing through the hospitals in New Haven's region, obviously it's Yale New Haven Hospital, and the 2 federally qualified health centers, we're relying primarily on them and are not having Dr. Murphy do testing anymore in the city. And that was effective, was that this past Monday, Director Bond?
Correct.
Yep. And
It
so
was this past Friday.
This past Friday. And so in the beginning of the crisis, there was a lot of limitations on the city's ability to do testing, and Dr. Murphy was very, very helpful in allowing us to increase our ability to test a lot of people, but that's no longer as much of an issue, and so we're relying on our partners at the Cornell Scott and Fairhaven Health and the hospital to do the testing moving forward.
Did you all also, did the complaints from people who got tested at Murphy that I reported on, did that influence your decision to end with Murphy, or was this strictly that the hospitals and clinics were increasing?
So I think it's fair to say that it was a concern of ours, but at the same time, it's also very important to underscore that Dr. Murphy, we had no examples where anyone was ever charged for any services that Dr. Murphy provided. Dr. Murphy bent over backwards to work with us to increase our ability to do testing in a variety of different ways. He was the first site in New Haven that people could literally walk up without a car. He was willing to help us test in many different sites around the city. And we had no issues and he followed through on his commitment to not charge anyone for testing.
And then my last question for the mayor, for Director Bond, maybe both, is, there's an election coming up and a few contested state legislative races. And I wonder if you have any legislative priorities for the city that you would like to see New Haven legislators push that are specific to COVID-19. So whoever wins these elections, what is it kind of most important from your perspective that you want New Haven state legislators to be advocating for around testing, contact tracing, whatever, to help New Haven's response to COVID-19 in the 2 years ahead?
Sure. So I think there's two parts to that question. One is we'll be working post-election with our state delegation, as we always do, to help support each other's initiatives as far as the legislative session in the coming new year. And we'll share more details on that. I would say specific to COVID, frankly, I would say the state legislators staying the course and ensuring that our delegation supports the governor's efforts and does not undermine them in any way, to allow Connecticut to be comprehensive in its science-based approach to addressing COVID. What does not work is if the state legislature takes away the governor's executive order powers and starts to make decisions on their own, because I believe that would create a very disorganized situation where we would be less able to enforce very, very important rules around COVID and keeping our communities safe. I'm not sure if that answers your question, but I think that it's a priority. Thinking about my conversations with other mayors in the state, what's important to us is financial resources to allow us to support individuals that potentially are losing their homes or apartments. The support that we're getting as far as testing goes and contact tracing, and I think overwhelmingly the governor has done a very good job at making sure that Connecticut is responding well to a difficult crisis. Great.
Thanks.
Any other questions here?
I have one. This is Allie from WNPR. Good afternoon. The governor signed his executive order last week about the ability to roll back to phase 2 if New Haven potentially got into a red zone like some other areas of the state. Is that something you would consider if the rates did spike, rolling back to phase 2?
Yes, absolutely. Frankly, I wish we had a little bit more flexibility about how proactive we could be about going back to phase 2. The governor has placed restrictions on the number of cases over the 14-day average. And, we're concerned enough about the situation that we might, if we had the flexibility, be a little bit more proactive on that front. I understand that other cities are considering this as well. Norwalk's considering it because their cases are higher. If we're looking at a 14-day average, I get concerned that similar to what happened early on in the spring, this thing can very quickly get out of hand, and we need to be very proactive to ensure that we're keeping our community safe. So that's absolutely on the table. And
for contact tracing in the city, has it revealed spread through small family gatherings, I believe. Ms. Bond, you mentioned that, and that's been the trend statewide. Is that what you're seeing in New Haven as well? Has there been any school spread or through sports outside of school?
Yeah, contact tracing is definitely still prominent in our city and reveals a lot of the gaps that we see. And some of the things that we see are very similar to what other cities are seeing. Social gatherings with external household members and or friends that are social gathering. We have also seen just inconsistent mask use in different workplaces and a gathering even within workplaces where people want to congregate around a lunchroom or a break room. And so hence our remarks early on about just being mindful of the social distancing and wearing a mask and following those critical basic principles to reduce the risk of exposure.
And I, just to kind of underscore the point, we've just seen a lot of sloppiness. And I think that as members of the community, we have to be really direct with other people that are sloppy in a way that's respectful. And I've been in a number of circumstances where someone doesn't have a mask on or someone doesn't put their mask over their nose, and just saying, hey man, can you put your mask over your nose? Is not a big deal, but it actually goes a long way to making sure that people understand that the norm is wearing a mask in the appropriate way. And that just like the norm now is to wear a seatbelt, it's respectful to other people to wear your mask in an appropriate way. And we should be holding each other accountable to make sure that we get on top of this thing quickly this time so it doesn't get out of control.
Yeah, and I just want to add that if you're positive and you are told to be in isolation and others have been told to quarantine because you've been exposed, to really follow those recommendations that are either from a health official or a provider, because that also poses a greater risk of exposure to others. And so I just want to remind the community about the accountability message that the mayor just indicated, that if you're positive, you have to follow those critical components and also protecting other household members that may live with you.
Any other questions from folks? All right, thanks everybody. Good to see you.